We are so lucky today to have the Minister of Menstruation with us, Candice Chirwa. We are so excited to have you, and we can't wait to get started on all the questions that we've got lined up. Welcome.
Thank you for having me. I'm excited for our conversation.
Okay, perfect. So I want to dive right in. Tell us a bit more about yourself for those that don't know,
Mhm.
and a bit more about because it's a movement, really.
Sure. Yeah. I am really just a passionate menstrual health activist who is really trying to get society to understand the importance of menstrual education. When I started my period at 10, I felt that there wasn't any support, resources, and it can be such an isolating time because it is a pivotal stage for formative years. So, yeah, as the Minister of Menstruation through my organization, Curate, we travel around the country just to provide menstrual education workshops. We also do online sessions where we partner with experts in the field so that people can learn more about the menstrual cycle, because I think it's such a incredible thing. It's not just about your period every single month. It's about how you eat, how you take care of yourself. Your mental health can have an impact on it. And so even myself, I'm always learning as I go. And so it's been an incredible honor doing this work, and I think there's still so much work to be done, but we take it one day at a time.
Exactly. So now you briefly explained why you're so passionate about it, but tell us a bit more about that journey.
Yeah, so the journey started when I was 21. So I had done research at the United Nations, where I was tasked with looking at like what different policies are happening within Eastern and Southern Africa. And the key word that just kept popping up during that time was under-researched, underlooked, private issue. And then I decided to pivot into my master's, looking at why menstrual health needs to be treated as a human rights issue. And through that, then I was sparked in, starting Curate, which is the nonprofit where we do menstrual health workshops, and really just going into communities, going into schools, providing this opportunity and safe space to have period positivity for young girls in particular. And that just really grew as a movement where people were willing to now be open to having conversations about menstrual health, but also be willing to have conversations that they wouldn't often have the opportunity to. So what I realized is, as this movement with Curate was building, I then was also afforded the opportunity as the Minister of Menstruation to allow for people to come and speak openly about their experiences, whether they be in high school, whether they be in corporate, whether they're just a normal person who's trying to navigate bringing up periods to their partner. It was just really about creating those safe spaces and creating that content for people to realize that this is deeper than us bleeding for 7 days. We need to have the opportunity to realize that it's linked to a lot of other things, and we need to speak openly about it. And so, yeah, it's been a really great journey so far.
I love that. So can you tell us maybe some South African based stats?
So the South African-based stats, I do feel are pretty outdated. When we look at some of the
Yeah.
stats from 2018, 2019, that say 7 million girls cannot afford period products, I do feel like that number could be more, especially because during COVID exacerbated period poverty. You were stuck at home, didn't actually have the financial means to buy these period products. It also meant that, you had to find different ways to use different materials. I know that a grassroots NGO called I Menstruate did a study where they said that 83% of South African girls actually miss out on school because of their period. And they did look at schools in all 9 provinces. And I think what was interesting about that was that a lot of the young girls associated their periods in a negative light. They felt embarrassed,
Wow.
they felt terrified. So this is really interesting because as a grassroots organization that was getting this information from young girls directly, I think that sets a foundational understanding that period poverty is a crisis in this country, especially if you're coming from a background where you don't have the financial means to buy a basic necessity item. So I think just from that, when I am looking from recently just finishing my PhD, I think right now what South Africa needs a lot of investment in is the research and funding the research to see specifically the real lived obstacle, especially for young girls, for university students, and in also understanding the misconceptions that people in corporate face when it comes to menstrual health and what that would look like in terms of implementing a holistic policy that provides not only access to these period products, but also access to medical care that isn't too expensive, but is also affirming, right? So, yeah, I think for me in that perspective, I always say that the research could be more, and we need way more research, especially when I look at our counterparts overseas in terms of how they're constantly publishing and constantly finding investments into this. But I do think that it doesn't mean that it doesn't exist. It does exist, and it really requires a really holistic intervention to ensure that we see menstrual dignity in South Africa. Yeah.
Absolutely, and it's always surprises me how education is such a dual directional influencer at the bottom of so many health related aspects. It's always got such an influence. So bouncing off that, what are some of the issues that you're fighting to resolve, both for school going and workplace women? Obviously, medical care being one of them, and products.
I mean, it's as simple as saying that education is power. And I think in the case of menstrual health, when a young girl is equipped with the right information on what she is going through and knows what to expect, they will then be prepared on what to do next. Versus if the young girl has no clue on what to do, they often feel isolated, they don't know who to turn to. And if they only have some form of understanding of their period in a negative light, in the sense that they've been hearing rumors or gossip that if you start your period at an early age, it means that you've been naughty with boys, that then causes an element of shame and stigma that really leaves them to resort to just feeling isolated and not having a support system. And I think not having a support system in something that happens every single month and not knowing what to do every single month can really just make it be an anxious time. And so when you mix that with not having the actual products needed to manage this biological function, you're going to school, you're then worried about whether the toilet paper is going to hold this period blood, which often it won't. You're trying to focus in class and you know how important excelling in school is to unlock opportunities in your future. It becomes just such a nerve-wracking time. And so for me, I always believe actually that just speaking openly, but speaking factually as well, makes a world of difference. I've seen this especially during COVID when I would be creating sort of conversations about different things that people needed to know about in relation to their period. Like, do you know that your period pain should feel more like a cramp and not feel like something that's debilitating? And you would then see a wave of people coming together and saying, well, I actually do experience this debilitating pain, and I didn't know that I actually should see a doctor or practitioner or gynecologist, specialist. And that then opens a new wave of empowerment to say, I'm in control of my body. I'm in control of also being accountable to what happens with my body. And I therefore need to be tracking the symptoms. That in itself really opens, I guess, a sort of an empowerment to say, I can't just pretend like this is normal, especially if it's debilitating, if it's getting in the way of that. And that is just simply from talking openly, right? So I think
Yeah.
people shouldn't underestimate the power of the power of creating a platform that can bring positive change to people's lives. And I think that's what the Minister of Menstruation has been doing, just being able to allow people to say, there's a symptom that I might be experiencing where the week before my period, I feel extremely depressed. I don't know what that is. And rallying together and creating that support system to say, do you actually know that you might have PMDD? And there are various ways in how you can treat it. That, really is life changing. And so I just think it's education, it's empowerment, but then using that in a positive way to uplift others brings so much change to people's lives.
Absolutely. And just, I wanted to ask you as well, in terms of misconceptions when it comes to menstruation, what are some of the things that you've heard that have really shocked you? Probably
Sure.
a lot.
Definitely a lot. I think what's interesting is, especially from so we did a workshop with an all-girl private school. in Joburg. And, you'd think, okay, these girls don't necessarily have, like, they don't really experience period poverty. I mean, they have the opportunity, not even the opportunity, the financial means to buy whatever period product they want. But what was interesting was when having that conversation with them really understanding, or rather debunking, the period myths that they've been told. These are young girls who have access to information, but at the same time, they see their period in such a negative light that there was one girl who said that she doesn't wash her hair because she's been told that washing your hair on your period means all of your hair will fall out. There's one girl who said she was told that she shouldn't touch her pets because her pets will die quickly. And these are, you're sitting here, you're hearing these things, and you're going, okay, now, based on what we've learned about the menstrual cycle, and when we know where the uterus is placed, we know that the uterus is not connected to our hand. So there's not like blood is spurting out.
Is this a TikTok education, or what is this
I,
down to?
I don't know what
Wow.
it is. I think from what the conversations we all had was that they felt like, especially receiving the information from their parents or guardian, they felt like there's an element of protection. So don't do something because you don't want people to know you're on your period, or like make sure you wear like 2 pads and black underwear and 2 pairs of underwear so people don't know you're on, like, just this real-time protection at an all-girls school, which is really fascinating. And I think for me, what was interesting was just them learning about menstrual education, learning about the basic fundamentals of the menstrual cycle, and then going, oh, so clearly that myth doesn't make sense, because if I'm wearing a tampon or a menstrual cup whilst I'm swimming, sharks are not going to get me because there's a product that's collecting the blood, like things like that just really opened up their minds in a different light. But I also think what was interesting for them was them realizing that they shouldn't be suffering in silence. One girl was so sad to hear that her friend goes through really bad period pain and she still shows up to school, but she doesn't ask anyone for help. And they were able to really establish that form of sisterhood to say, if you come to school and you're experiencing really bad pain, ask me, I can get painkillers, or I'll bring a hot water bottle. So that for me was a real great experiment for social behavioral change, to say, I've learned so much about menstruation, I've debunked all these weird myths, and now I'm establishing a sisterhood where we can rely on each other. So yeah, there's a lot, like don't wash your hair on your period, don't swim in the pool because the blood will fill the pool. Don't touch pets because the pets will die quicker. Like this crazy, crazy information.
Wow. Sure. That's shocking, really. Okay, so in your opinion, how far behind do you think South Africa is compared to the rest of the world in terms of things like rights and policies to do with menstruation?
So when I
That
was doing my
Sa said it
PhD,
all.
no, I love it. I love it. I love it. I think it's an important question because I think a lot of people would assume that we are behind. But one thing that when I was doing my PhD research is that I saw that there is an willing initiative by government in particular to resolve the crisis on period poverty from a period product perspective. The establishment of the sanitary dignity framework, which was established in 2019, really has government committed to the distribution of period products for quintile 1, 2, and 3 and no fee paying schools. I do know that what they are willing to commit to, especially the Department of Basic Education, is bringing on period product organizations that would assist with the distribution of these period products to schools, because there are a lot of schools that don't even know that this policy exists but are in need of these period products to ensure that girls do go to school. And so there is at least an intention, there's at least a willingness to commit to this policy framework. But the issue about this policy framework is that it is a framework. So it's not implemented in law that then also states how much budget is set aside to different departments. And I think what also becomes tricky is that because menstrual health is intersectional in different departments, we're not entirely sure who is the main accountable partner to this specific issue. So you have the Department of Women, Youth, and Persons with Disabilities, you have the Department of Basic Education, you have the Department of Health, you have the Department of Sanitation, and this all links to menstrual health. And what will happen then is each department will think about how can they resolve this issue in different ways. So, for instance, you would have the Department of Basic Education, maybe for Women's Month, decide to distribute products to one school. Then you'd have the Department of Women and Youth and Persons with Disabilities maybe do it for the month of May or June. And so it's fragmented, it's not collaborated, not cohesive, and it's also not consistent because we all know that you menstruate every single month. And with the amount of schools that exist in South Africa, there needs to be, I guess, a better scaling up of getting access to these period products. And I think there needs to be better procurement programs in which government can identify locally manufactured period product companies, which there are so many, and get into a collaboration to say, we require you to distribute at least a minimum threshold of period products to this region. And at least then having that partnership ensures that the schools have access to this. And so, yeah, I think we're stepping in the right direction because even within the human rights perspective, within the Constitution, there is government willing to ensure that there is dignity sort of achieved in this. But I do think from a logistics perspective, from a technicality perspective, it does become a bit tricky when if it's not implemented as a full-on policy, we don't know how much budget is allocated to who. And then it's very difficult from like, yeah, who's accountable? How do you measure the distribution? And so that partnership, I think, aspect would be super important for several departments to identify key stakeholders, partner with them, and ensure that they're getting that necessary reporting back consistently. Yeah, so it's a good picture, but I do think now we need to get to the right form of implementation to ensure
Yeah,
that justice is
absolutely.
prevailing.
So this leads us to the next question. If we had a magic wand, what is one menstruation policy you'd implement immediately?
Yeah, definitely menstrual leave, which when I say menstrual leave, people think it's such a controversial thing. And when you think of it, menstrual leave has existed since 1920, and it's not a new thing to have maybe 2, 3 days off from work, especially for people who really experience their hormones fluctuating. Yeah, and it has an impact on productivity, it has an impact on so many other things. Even if you don't have endometriosis or PMOS, you can experience just brain fog. You're not your usual self, and that's totally fine. But I
Or you
think
faint. Hormones and everything, you're prone to fainting. I mean, there's so many things that it causes in a woman. Not all of us are the same. We all present differently. But it's
exactly.
debilitating sometimes.
It is debilitating. And so I think if employers are really about the bottom line and ensuring that they're always having their employees meet certain KPIs and they worried, like really fit on productivity, I do believe that there are ways in which you can cater to menstruators in the workplace. So if it's a thing of, okay, we can't really assist with ensuring that our employees take 2 days off because they have to build a car, maybe you can give them longer lunch breaks, or you can have a wellness room, or you can also have vending machines that cater to having the necessary period products that also speak to the different symptomatic care as well, right? So you can provide ways in which your workspaces are period positive and period friendly. So I think, yeah, people think when you speak about menstrual leave, it's a way for women and menstruators to be further discriminated against. And I just don't think that's the case. I just think that if we are given the opportunity to really rest and recover, which is a necessary and integral part of your menstrual cycle, you need the rest. I think then companies can meet us halfway. So yeah, that's one thing that I would implement. And I think it's one thing that even in the menstrual health bill that we presented to Parliament in April, we had mentioned that menstrual leave should be integrated into this. And a lot of people were in support of it, right? So it's something that people are advocating for, not to take a further excuse to be off work, but just to say, meet me halfway. This is a natural biological function that I go through, and I just need some form of care. Yeah.
I mean, I used to work in a corporate setting, and I was very lucky to work within a women's team. There was only one guy, and we all started syncing. Obviously, our cycles were syncing, and so we'd all huddle together, eating chocolate and whatnot. And we had some of us had blankets under the desk, or hot water bottles. But it was such a nice feeling because there's support within the team, and obviously we'd kind of support each other without it becoming obvious professionally, you know. But I think it's something that people do need to discuss and look at. I just wanted to quickly touch on period poverty because you've mentioned it a few times. Can you just clarify what that term is for people that don't understand?
Sure. So the way I always define period poverty is imagine if you don't have access to toilet paper, what sort of alternative means would you use? But imagine that being your reality every single day. And that then having an impact on being able to go to school because you're too worried that because you don't have this necessity product, that you're worried about how you'll smell or you're worried about the stains it'll leave on your clothes. And so you're being held back from participating in society, whether it means going to school, going to work, because you don't have access to this necessity item. But the definition of period poverty goes beyond just the access to period products. It speaks to the various other things you require to manage your period in a dignified and safe way. So let's say we say, like if I'm president for the day and I say, okay, also period products are free and everyone has access to them. But then you think about girls who then still have to change their period products, especially the disposable period products in sanitation, like in a bathroom that doesn't have a closing door, that doesn't have running water, there's no waste management facilities. You've barely solved the issue when it comes to there's so many things regarding that. And then you think about then not only just having access to the education that's needed to walk you through the stage of puberty and sexual reproductive health, but then you also then have to think about a young girl who's going through intense period symptoms, and then has to wait in the queue at the clinic for hours on end just to be met with a doctor or a nurse, and they just tell you, take a grandpa or Panado and it'll be sorted, right? So there's also a diagnostic sort of discrimination that takes place. And so it really, I think with period poverty, it really, yes, looks at the hardware aspect of it. So you don't have access to the period products. Not having access to the period products means you can't go to school, you can't go to work, and that leaves a range of consequences on your dignity and your human rights. But then it's also looking at the things you require to manage your period with dignity and care. You need access to water, you need access to sanitation. You also need the education, the healthcare. So that's how I would describe it. And sometimes people always just think like period poverty means, you're poor from your period, you don't have access. And it's like, yes, you don't have access to the products.
There's layers. There's so many layers.
Yeah.
I wanted to go back to talking about pain levels. Let's just chat about the differences between sort of how normal, like I said, we don't present the same, and some months are different to others depending on what's going on. And endometriosis adds yet another level to that. So how is this all affected by hormones, and how do we kind of manage it better? So it's a very difficult question because that once again many layers.
I don't even think some, I guess, doctors would even know in terms of how do you manage like the period pain, because there's various ways depending on your menstrual cycle, the amount of hormones you have. So what I know is that there's two types of dysmenorrhea. You have the primary dysmenorrhea and then the secondary dysmenorrhea. So the primary dysmenorrhea is like the typical cramping sensation you feel when you're on your period that I would often describe comes in like a wave or a contraction. It comes in and it goes. It gets really intense. If you take any over-the-counter medication, or you take perhaps any holistic medication, whether it be ginger tea or supplements, it will go away. It should go away. But then with secondary dysmenorrhea, you're experiencing really intensive pain that has an impact on your ability to get up. You're really just struggling to move, to live life. And even when you try and take any standard form of medication, that pain still exists and it's still severe. That for me is then when you're required to go and see, I wouldn't even say a general practitioner, because sometimes what happens is when you see a general practitioner, they'll say, oh, maybe you should just be put on birth control, or just let's put you on a stronger form of medication, which could be Schedule 4, Schedule 5, and that makes you drowsy, then you're also not as productive. And so seeing a specialist, i.e. a gynecologist, is super important. And I think what happens is that what I always tell people is that you need to always be tracking your symptoms and logging them, whether it be in a menstrual diary, like a physical diary, or on your phone, so that you are your own advocate for your body, because your gynecologist doesn't know your body other than you. So you have to tell the gynae for the past 3 cycles or past 3 months, I've been experiencing all of these other symptoms, but now all of a sudden I'm experiencing this really intense pain that I've never come across. I really require your assistance. Then they will know, okay, so I've seen this constant pattern. Now all of a sudden you're experiencing this. Has there been any changes regarding your lifestyle? Is there something that you might be experiencing that's causing a lot of stress? Are you losing weight? Are you underweight, overweight? Like there's a long checklist that has to go through, right? But also then I think what happens is that we also don't know what to expect when we're going to our gynecologist. So we just expect them to like walk us through and be the experts, which is fair. But you also need to then be like, I know that I need to maybe, especially if it's a severe pain, I need to get blood tests done. I need you to do the
Yeah.
sonar test,
Ultrasound.
ultrasound. Yeah, yeah. And that can either be done with the wand or actually looking on your tummy. Things like that. Like, I think it's super important that we equip ourselves with as much information to say, what should you know for your first gynae visit and what should I advocate for? And not just sitting there and just shaking our heads. Like, you are the advocate for your body. So I think, yeah, even in certain cases, like I would ask my gynae, like, why do I get that sharp pain in my butt? Like, what is that about? And so the funny
The
thing is, she
lightning
said,
bolt.
it's a lightning bolt. I hate it. But she said it depends on the amount of prostaglandins you have. And your prostaglandins are dependent on how you ate the previous month. Are you really stressed? Is there like your external world and what you feed your body can have an impact on how your body responds to you. And she said that gut health is linked to your menstrual health. So what you eat in particular can impact the pain that you might experience. So that was also really interesting. And I think from that, took a more holistic perspective of how I treat my menstrual cycle. So the week before my period, I don't drink coffee at all because I know caffeine is an aggravant for period pain. And this is other things that I choose to do that just helps and assists for me to then at least have a pleasurable period. Pleasurable.
Yeah. No, but you're so right because hormone health is another huge thing that can add a whole another sort of impact, and also environmental health. There's so many things. Like you say, even your mental health for that
Yeah,
month, maybe you've had a really stressful, like you mentioned, and it
yeah.
just makes it so much harder. Okay, great. I wanted to ask you, do you think are we getting any closer to getting rid of the stigma? Obviously, you're making big strides in that.
Yeah.
Yeah.
I don't think so. I don't know. I think for me, what I find to be interesting when it comes to the stigma, when I look at it like from 8 years ago, I think there's definitely been major progress. But I do think there could be more, especially from like a menstrual education perspective towards parents and guardians and teachers. I think they could really create the safe environment in which young people, young learners can speak more confidently and more openly about their menstrual health. And I think for me, what I just find to be really interesting is that when we have the workshops directly with young learners, they feel very confident, but then they worry, like, how would their parents receive the information that they've just gotten from this workshop? So there is that
Oh,
barrier
that
where,
generational.
yeah, the generational barrier where you'll find that a young girl will be like, oh, I loved the workshop, but based on the information my mom told me about my first period, I don't know how she's going to feel knowing that I've learned the information from this workshop. So I do think that even as society is progressing and we're building a period positive generation, a young period positive generation, we also still need to look at what the older generation has to say, because these learners, these young people still need to rely on their parents, still need to rely on their teachers. So yeah, I think it's so. I don't know. Like, I feel a bit on the fence on it because I guess because of who I am as a Minister of Menstruation, people automatically will then always come to me and speak about menstrual health, but you can never
Yeah.
track what their behavior is post conversation. Like, are they able to go home and still have a positive conversation? I must admit, through our initiatives at Curate, where we have period positive stalls and we engage positively with men and we run this period pain simulation experience, men
I love
really,
that. I love it.
yeah, men really tend to have a positive outlook. And I think after they walk away from that experience, they go and they think, yo, I need to show up a bit better for my wife, for my daughter, for my sister, for my partner. And I think that's a good shift in society. That's a good thing that we're doing there. So I think, yeah, they were at least willing to engage. They're at least willing to try out this experiment, which I think if you think 10, 15 years ago, people were not even willing to say the word period. So I think from that, it's a good indicator. Yeah.
Amazing. I wanted to ask you, was your PhD sort of specific, your research for that specific to menstruation?
Yes. So my PhD looked more around how menstrual health, rather I'd say menstrual health management, MHM, became a norm within the international realm and just looking at who the key players were in making that to be a norm. Because norms sometimes, like, when you think of just certain things that we abide by as society, norms come up and you think, how did this become a norm in society? Who were the players? And that's basically what my research is looking at. And what I did is I looked at 3 country case studies, being Scotland, South Africa, and India, and just seeing how these norms in these countries became a policy and who the key policymakers, entrepreneurs, your activists, your educators, how they went about to ensure that menstrual health was recognized as a key policy and a key human right within that field. So, yeah, it was really just process tracing the history and looking at how it traveled and became a norm and how it then became a policy or localized within those countries.
Wow, that's fascinating. That's really, really interesting. So I wanted to ask you, are there any upcoming events or workshops or collabs for Curate?
So, yeah, usually we always tend to have like employee engagement events with our corporate partners, especially as Women's Month builds up. There's always important conversations looking around wellness. I think, even from our perspective, we will most likely be doing workshops in July for Nelson Mandela Day, for schools, having exhibition stalls, just really allowing us to interact with public. So these things are usually just like private within the corporate space, but we also then do workshops based on schools requesting the team to be available. And I think what's always interesting is that when it comes to menstrual health, people tend to just think about it like last minute. So they'll be like, oh, Women's Month's coming up. What's one thing we can do? Menstruation. You're like, well, we should be thinking about menstrual health initiatives every single month. But we're always grateful for the opportunity to collaborate with organizations just as a way to bring about impact and also just as a way to empower learners.
Perfect. And if someone wants to get hold of you, what is the easiest way to do that? Your Instagram, which is Minister of Menstruation.
So, yeah, like you said, Minister of Menstruation. If you go on Instagram, there is a link in the bio. And so when you click on that link, you'll have all the icons to LinkedIn. You can get access to there. And then also in my bio, there's the link to Curate. So if you want to do menstrual education initiatives or workshops, more than welcome to just also pop us an email there, because when you click on email, it'll pop up there. So yeah, that's basically, I would say social media is the way to get access to us.
Thank you so much for joining us today, Candice.
Thank you for having me.